I'm Lieutenant Brubaker, an aerospace and operational physiologist. Today I'm going to talk to you about the physiological hazards of flight and the risks associated with these hazards, how to prevent these hazards from affecting you, and how to recognize them, then correct for these physiological situations you might encounter while flying. The objective of this lesson is to understand the different mission-imposed threats aircrew encounter and recognize the sources, the effects on human performance, and the preventable strategies. Today we'll be covering the atmosphere and altitude-related threats, hypoxia, oxygen systems, hyperventilation, trapped gas, and motion sickness. Let's get right into the composition of the atmosphere. Notice that 78% of the atmosphere is nitrogen, 21% is oxygen, and other gases make up 1%, both at sea level and at 35,000 feet. These percentages remain the same up to 50 miles from the Earth's surface. As you increase in altitude, the atmosphere becomes less dense. In other words, the pressure decreases because there are fewer molecules of gas present. However, the percentage of each gas remains the same. Because there are fewer total molecules, there's also fewer oxygen molecules per unit volume. Same for nitrogen and the other trace gases. A physicist or meteorologist would divide up the atmosphere this way. The densest layer of the atmosphere is the one closest to the Earth, the troposphere. Almost all flying takes place in the troposphere. It extends from the Earth's surface to between 30,000 and 60,000 feet. Why such a large range? The top of the troposphere is higher at the equator, where warm air is always rising, and lower at the poles, where cool air is sinking. The upper limit of the troposphere, the tropopause, is where the temperature decrease stops. We now want to concern ourselves with the physiological divisions of the atmosphere. 10,000 feet and below is considered the physiological zone. Below this, the partial pressure of oxygen is sufficient enough to sustain normal human function. 10,000 feet and above is considered the physiologically deficient zone. This is where the partial pressure of oxygen has gotten too low to support and maintain normal human function. Once you're in this zone, supplemental oxygen is necessary. 100% oxygen is needed between flight levels 340 and flight level 390, while 100% oxygen under pressure is required above flight level 390 in order to keep an individual in the physiological zone. At flight level 500, a pressure suit is needed. So why a pressure suit, you might ask? The constant partial pressure of water vapor is 47 millimeters of mercury, and the constant partial pressure of carbon dioxide is 40 millimeters of mercury. The sum of these partial pressures equal 87 millimeters of mercury, equal to the atmospheric pressure at flight level 500. Because both water vapor and carbon dioxide exist in the lungs, the alveolar partial pressure is also equal to 87 millimeters of mercury, and a pressure suit is required to initiate gaseous diffusion across the alveolar membrane. Armstrong's line at 63,000 feet is the altitude at which water will boil at 98.6 degrees Fahrenheit, body temperature. Water boils at 212 degrees Fahrenheit at sea level. An individual's blood at this altitude will boil without a pressure suit due to the extremely low ambient pressure. Now that we have covered how the atmospheric pressure decreases as we increase in altitude, we will talk more in depth about how these pressure changes affect the human body. The topic that may most be on your mind for today is hypoxia. Hypoxia is a state of oxygen deficiency in the blood, cells, and tissues sufficient to cause impairment of function. Hypoxia is not the same as a lack of oxygen. A complete lack of oxygen is called anoxia and is only survivable for a very few minutes. Hypoxia is the presence of oxygen, but not enough oxygen to function normally. So, what is impairment of function? And how can you tell the difference between impairment of function and just a bad day? One of our jobs is to give you some very specific ways to recognize hypoxia. Subjective symptoms are things that you yourself will experience, and they're different for everyone. We still have the altitude chambers because I can't say when you feel X, Y, and Z, get on oxygen, because I don't know what you're going to feel. My goal for this presentation is to make you aware of the symptoms of hypoxia. That way, if you ever experience any of them, you will be able to recognize the symptoms and then take the corrective procedures. Let me mention two things that aren't on this list because they're not symptoms of hypoxia. Pain. You'll not feel pain. It's not like when you touch a hot burner on the stove and immediately know that something is wrong. Sense of suffocation. On TV, when people are trapped in a cave or a safe and running out of air, You hear them gasping and struggling to breathe. It's not like that. You will not feel like you can't breathe. That's anoxia, remember? Each individual will experience their own symptoms, which will vary with such factors as age, physical condition, temperature, and the degree of apprehension. And individual symptoms will not vary significantly throughout their life. The warning signals most important to the aircrew member are those that they can actually sense and identify. These symptoms are emphasized as a means to recognize hypoxia during aircraft flight. Subjective symptoms that have been reported are air hunger or oxygen want, a feeling of apprehension, headache, dizziness, fatigue, nausea, hot and cold flashes, blurred vision, tunnel vision, tingling, and numbness. Euphoria and belligerence might be noticed by the subject. Objective symptoms are those symptoms that you could see in other crew members that are experiencing hypoxia during flight. Having a better understanding of these symptoms should provide a basis for recognition of the problem if it happens to you or crew member in an aircraft. Another mission concern during flight is hyperventilation. How will you know if you are hyperventilating, possibly feel lightheaded, faint, or numb? Notice all of these symptoms could also be symptoms of hypoxia. You don't have to be breathing very rapidly to hyperventilate. You can also breathe slowly but very deeply, or both rapidly and deeply. There are three causes for hyperventilation. The first, emotional stress, is well known. As I mentioned earlier, hypoxia can lead to hyperventilation. And finally, improper pressure breathing can result in hyperventilation. In this case, it's easy to let the regulator fill your lungs faster and deeper than usual, and faster and deeper than you need. Then when you exhale and release too much carbon dioxide and have symptoms of hyperventilation. Since the symptoms for hypoxia and hyperventilation are so similar and time is of the essence, we're going to treat each condition in the same manner. Current AFI places restrictions and limitations on both altitude and type of supplemental oxygen systems that will be used during your orientation flight or orientation jump. Your instructor pilots and jump masters will cover specific information applicable to your orientation flight or jump event. Should you experience hypoxia, corrective procedures will include going on oxygen and utilizing whatever system is available, usually a nasal cannula or a passenger oxygen mask, depending on your event. Boyle's law states that pressure and volume are inversely related. As you ascend in altitude, gas expands, and as you descend, it contracts. This is because the changes in partial pressure directly affect the volume of the gas. Wet gas will double in volume at 16,500 feet and dry gas at 18,000 feet. Because wet gas is prevalent within our body, we need to understand the implications of this gas expansion. The body can withstand enormous changes in total barometric pressure, such as the hypobaric conditions of the altitude and to the hyperbaric conditions of diving, as long as air pressure in the body cavities can be equalized with the ambient pressure. The gastrointestinal tract, middle ears, sinuses, and respiratory tract are the body structures that normally contain gas. This gas may be swallowed air or other gases generated in the GI tract. These gases are influenced by pressure changes occurring outside the body. When the pressure is decreased on ascent to altitude in an aircraft or hyperbaric chamber, the gases will expand. When descending from altitude or low pressure environment, the gases will contract. This mechanical response to decreased and increased pressure is in accordance with Boyle's law. This is a graphical representation that clearly shows how pressure change affects the middle ear. When the pressure is the same on both sides of the eardrum and the eustachian tube is open and clear, there is no pain or pressure. There is no excessive pressure on the membrane. The middle ear is the air-filled space between the eardrum and the organ of hearing. When you ascend in altitude, the air expands. The expanding air will be released through the eustachian tube. This is a tube that opens up inside the throat. On ascent, you may be aware of popping or clicking sensations in the ear. This is the pressure being released through the eustachian tube. On descent, the gas in the middle ear contracts and the eardrum will be drawn in, which can close the eustachian tube. This may prevent air from entering the middle ear and equalizing pressure difference. On descent, you need to actively do something to equalize the pressure in your ears. The Valsalva maneuver is the preferred method. When you do a Valsalva, pinch your nose, shut and blow hard, but not too hard, as if you're trying to blow your nose. You should hear your ears pop. There are other things that can be done to open that eustachian tube and allow gas to enter the middle ear. Yawning, chewing, swallowing, moving your jaw back and forth, especially against the tight-fitting mask, can all open the eustachian tube. If you do have a middle ear problem, it's more likely to occur on descent than on ascent because the eustachian tube acts as a one-way valve. It is possible to have a problem on ascent. If the eustachian tube is swollen by inflammation or blocked by mucus, it can be blocked. If pain is experienced on ascent, the only way to relieve it is to descend immediately. Then, wait to fly until the eustachian tube is no longer occluded or swollen. The warning sign for ear problems is dull hearing or a feeling of fullness in the ears. If you don't take care of it then, it progresses to pressure and then to pain. There are a number of air-filled spaces in the skull. The sinuses, the ones that most often cause a problem, are the ones directly above and below the eye. Not because they're the largest, but because they have the smallest drainage holes. The drainage holes for these sinuses are only about 1 millimeter in diameter. If those tissues are inflamed and swollen, or if the drainage hole is blocked by mucus, that means there is a closed air pocket. With sinuses, there's no warning sign. There's no dull hearing or feeling of fullness as in the ears. Instead, the first sign of trouble is pain, and it can be quite severe. If the sinus ducts are open, there's no discomfort. However, if the openings of the sinus ducts are malformed or swollen due to an upper respiratory infection, there may be a tendency for blockage of the ducts. The blockage is referred to as sinus block. Sometimes upon ascent, a blockage will occur at the opening of the duct within the sinus. This will prevent the expanding gas from venting to the outside, and as the pressure builds up within the sinus, localized discomfort will occur. Since the pain from sinus blockages can be severe with little or no warning, any potential case should be checked by a flight surgeon prior to a chamber flight. Frequently, with blockages of the ducts leading to the maxillary sinuses, it is difficult for the individual to differentiate the pain. The pain may be referred to the upper teeth and can be mistaken for a tooth problem rather than a sinus problem. If a patient is experiencing trapped gas expansion within a tooth, they will be able to pinpoint exactly which tooth is causing the problem. In order to prevent ear and sinus problems while flying, you must make sure you Valsalva on descent. Don't wait for the buildup of pressure to develop into pain, and never fly or jump with a cold. Motion sickness is caused by mismatched or prolonged input from sensory organs. Some typical contributors are anxiety, unusual environments, lack of visual cues, erratic head movements, and pre-existing illnesses. Air sickness is a form of motion sickness where an abnormal physiologic state is experienced with some or all of the signs and symptoms of malaise, drowsiness, sweating, nausea, pallor, headache, and vomiting. Air sickness is a common problem encountered in pilot training and may affect nearly 80% of students to some degree. These items will influence air sickness. Be sure to avoid greasy, fatty foods, acidic, caffeinated and carbonated drinks, along with dairy products. Do eat all meals, have adequate carbohydrates 90 to 120 minutes before flying, and stay well hydrated with juice, water, or diluted sports drink. 6 to 8 hours of peaceful sleep is recommended. Adequate rest improves tolerance to G's, heat, and physiological stress. Also, when dressing in the morning, keep your flight suit loose and as comfortable as possible. Proper pre-flight preparation will help decrease the anxiety associated with flying. Keep a positive mental attitude and make up your mind that air sickness will not shake your determination to fly. Any illness can lower your air sickness threshold. Direct air vents toward your neck when possible. Be careful of rapid head movements. With turns, first, move your eyes to the area you want to look, then follow with your head. Keep your situational awareness, and don't be caught surprised. Perform deep diaphragmatic breathing when air sickness symptoms begin. Assume a comfortable position. Close your mouth and inhale slowly through your nose. Your abdomen should expand more than your chest. This helps prevent air swallowing and hyperventilation. Slowly exhale through your mouth. Puckering your lips helps to control the escape of air. Continue at a slow, comfortable pace. Resume normal breathing if you begin to feel dizzy. You may be hyperventilating. Also, resume normal breathing once your air sickness symptoms have been controlled. Last but not least, be active and involved. Ask questions. If allowed, take control of the aircraft. Focus on getting your mind off of your air sickness. In summary, we covered the atmosphere and its divisions, altitude threats associated with atmospheric pressure changes, hypoxia and how to prevent it, recognize it, and correct for it, oxygen systems that you might have to use, hyperventilation and how to prevent and correct for it, trapped gas and how it can affect your body, and motion sickness and how you can prevent it from ruining your flight.